Hey, Alpha Nurses, I'm Licensure from alphanurseguide.com. This is 18 Practice NCLEX questions. Without delay, let's get started.
Which of the following diets would be most appropriate for a client with chronic obstructive pulmonary disease? 1. Low-fat, low-cholesterol diet. 2. Bland, soft diet. 3. Low-sodium diet. 4. High-calorie, high-protein diet. The correct answer is 4. The client should eat high-calorie, high-protein meals to maintain nutritional status and prevent weight loss that results from the increased work of breathing. The client should be encouraged to eat small, frequent meals. A low-fat, low-cholesterol diet is indicated for clients with coronary artery disease. The client with COPD does not necessarily need to follow a sodium-restricted diet, unless otherwise medically indicated. There is no need for client to eat bland, soft foods. The nurse assesses the respiratory status of a client who is experiencing an exacerbation of chronic obstructive pulmonary disease secondary to an upper respiratory tract infection. Which of the following findings would be expected? 1. Normal breath sounds. 2. Prolonged inspiration. 3. Normal chest movement. 4. Coarse crackles and rhonchi. The correct answer is 4. Exacerbations of COPD are commonly caused by respiratory infections. Coarse crackles and rhonchi will be auscultated as air moves through airways obstructed with secretions. In COPD, breath sounds are diminished because of an enlarged anteroposterior diameter of the chest. Expiration, not inspiration, becomes prolonged. Chest movement is decreased as lungs become overdistended. When teaching a client with chronic obstructive pulmonary disease to conserve energy, the nurse should teach the client to lift objects. 1. While inhaling through an open mouth. 2. While exhaling through pursed lips. 3. After exhaling but before inhaling. 4. While taking a deep breath and holding it. The correct answer is 2. Exhaling requires less energy than inhaling. Therefore, lifting while exhaling saves energy and reduces perceived dyspnea. Pursing the lips prolongs exhalation and provides the client with more control over breathing. Lifting after exhaling, but before inhaling, is similar to lifting with the breath held. This should not be recommended because it is similar to the Valsalva maneuver, which can stimulate cardiac arrhythmias. Which of the following is a priority goal for the client with chronic obstructive pulmonary disease? 1. Maintaining functional ability. 2. Minimizing chest pain. 3. Increasing carbon dioxide levels in the blood. 4. Treating infectious agents. The correct answer is 1. A priority goal for client with COPD is to manage the signs and symptoms of the disease process so as to maintain the client's functional ability. Chest pain is not a typical symptom of COPD. The carbon dioxide concentration in the blood is increased to an abnormal level in clients with COPD. It would not be a goal to increase the level further. Preventing infection would be a goal of care for the client with COPD. When instructing clients on how to decrease the risk of chronic obstructive pulmonary disease, the nurse should emphasize which of the following? 1. Participate regularly in aerobic exercises. 2. Maintain a high-protein diet. 3. Avoid exposure to people with known respiratory infections. 4. Abstain from cigarette smoking. The correct answer is 4. Cigarette smoking is the primary cause of COPD. Other risk factors include exposure to environmental pollutants and chronic asthma. Participating in an aerobic exercise program, although beneficial, will not decrease the risk of COPD. Insufficient protein intake and exposure to people with respiratory infections do not increase the risk of COPD. Which of the following indicates that the client with chronic obstructive pulmonary disease who has been discharged to home understands the care plan? 1. The client promises to do pursed lip breathing at home. 2. The client states actions to reduce pain. 3. The client will use oxygen via a nasal cannula at 5 liters per minute. 4. The client agrees to call the physician if dyspnea on exertion increases. The correct answer is 4. Increasing dyspnea on exertion indicates that the client may be experiencing complications of COPD. Therefore, the nurse should notify the physician Extracting promises from clients is not an outcome criterion. Pain is not a common symptom of COPD. Clients with COPD use low-flow oxygen supplementation to avoid suppressing the respiratory drive, which, for these clients, is stimulated by hypoxia. When developing a discharge plan to manage the care of a client with chronic obstructive pulmonary disease, the nurse should advise the client to expect to 1. Develop respiratory infections easily. 2. Maintain current status. 3. Require less supplemental oxygen. 4. Show permanent improvement. The correct answer is 1. A client with COPD is at high risk for development of respiratory infections. COPD is slowly progressive. Therefore, maintaining current status and establishing a goal that the client will require less supplemental oxygen are unrealistic expectations. Treatment may slow progression of the disease, but permanent improvement is highly unlikely. The nurse is instructing a client with chronic obstructive pulmonary disease how to do pursed lip breathing. In which order should the nurse explain the steps to the client? 1. Breathe in normally through your nose for 2 counts. 2. Relax your neck and shoulder muscles. 3. Pucker your lips as if you're going to whistle. 4. Breathe out slowly through pursed lips for 4 counts. The correct order is 2, 1, 3, and 4. The nurse should first instruct the client to relax the neck and the shoulders and then take several normal breaths. After taking a breath in, the client should pucker the lips and finally breathe out through pursed lips. When asked about her stresses before admission, an anxious client stares blankly at the nurse and mutters unintelligibly. Which of the following descriptions of the client's behaviors should the nurse document in the client's chart? 1. Client cannot answer any questions asked at this time. 2. Client is uncooperative during the admission procedure, refusing to answer any questions. 3. Client responded to questions with a blank look and incomprehensible mumble. 4. Client stared at the wall when asked questions and was disoriented and incoherent. The correct answer is 3. The nurse must be objective in documenting the client's behavior, recording exactly what the client did or did not say or do in a particular situation. Recording that the client could not answer any questions, was uncooperative and refused to answer questions, or was disoriented and incoherent is not described and is a subjective interpretation on the nurse's part. One of the important aspects of the client's rights is the right to treatment in the least restrictive environment. The nurse observes this principle when making which decisions. Select all that apply. 1. Referring a client to a group home or supervised apartment living. 2. Releasing client information to a primary care physician or a relative. 3. Placing a client in seclusion or restraints. 4. Respecting the client's right to accept or refuse treatment. 5. Placing a committed client in a daily outpatient group or a weekly self-help group. The correct answers are 1, 3, and 5. Group homes, apartment programs, seclusion, restraints, day treatment programs, and self-help groups all involve degrees of restriction and supervision. Releasing information about the client is governed by legislation and rules of confidentiality. Accepting or refusing treatment is governed by laws related to informed consent. An outpatient visit 3 months after discharge from the hospital. A client says he has stopped his olanzapine even though it controls his symptoms of schizophrenia better than other medications. I have gained 20 pounds already. I can't stand anymore. Which response by the nurse is most appropriate? 1. I don't think you look fat. Why do you think so? 2. I can help you with a diet and exercise plan to keep your weight down. 3. You can be switched to another medicine. 4. Your weight gain will level off if you stay on the medication 3 more months. The correct answer is 2. Helping the client control his weight is the most appropriate approach. The nurse's contradiction of the client's statement is inappropriate. Most atypical antipsychotics cause weight gain and are not a solution to the weight gain. There is little evidence that weight gain from taking olanzapine decreases with time. As hospital-based care has become more oriented to crisis intervention, criteria for admission to the hospital have also changed. Which clients have priority for admission to an acute care facility? Select all that apply. 1. Clients who live alone. 2. Clients who are acutely psychotic. 3. Clients who are acutely depressed. 4. Clients who are dangerous to self or others. 5. Clients who are not sleeping and have a lack of appetite. 6. Clients who are not complying with medication regimens. The correct answers are 2 and 4. Safety issues, including protection of the client and others, are the priorities for admission. Acute psychosis commonly involves issues of safety. Living alone is not a sufficient reason to be admitted to a healthcare facility. Depression, insomnia, lack of appetite, and noncompliance are important issues, but not sufficient for admission unless combined with one of the other criteria. The nurse is assessing a client who is taking an antipsychotic medication. Which of the following symptoms is uniquely indicative of neuroleptic malignant syndrome NMS and requires immediate attention? 1. Very high temperature. 2. Muscular rigidity. 3. Tremors. 4. Altered consciousness. The correct answer is 1. Muscular rigidity, tremors, and altered consciousness are symptoms of other movement disorders as well as NMS, such as extrapyramidal side effects. High temperature is unique to NMS, particularly when seen with the other 3 symptoms. NMS is potentially fatal and needs immediate attention. The nurse reviews a client's electrolyte results and notes that the potassium level is 5.4 milliequivalent per liter. Which should the nurse observe for on the cardiac monitor as a result of this laboratory value? 1. ST elevation. 2. Peak P waves. 3. Prominent U waves. 4. Narrow peak T waves. The correct answer is 4. A serum potassium level of 5.4 milliequivalent per liter is indicative of hyperkalemia. Cardiac changes include a wide, flat P wave, a prolonged PR interval, a widened QRS complex, and narrow peak T waves. A 36-year-old multigravida client is admitted to the hospital with possible ruptured ectopic pregnancy. When obtaining the client's history, which of the following will be most important to identify as a predisposing factor? 1. Urinary tract infection. 2. Exercise during pregnancy. 3. Episodes of pelvic inflammatory disease. 4. Use of estrogen-progestin contraceptives. The correct answer is 3. Anything that causes a narrowing or constriction in the fallopian tubes, so that a fertilized ovum cannot be properly transported to the uterus for implantation predisposes an ectopic pregnancy. Pelvic inflammatory disease is the most common cause of constricted or narrow tubes. Developmental defects are other possible causes. Ectopic pregnancy is not related to urinary tract infections. Exercise during pregnancy is not associated with ectopic pregnancy. Progestin-only contraceptives and intrauterine devices have been associated with ectopic pregnancy. The nurse is caring for a client with a nasogastric tube that is attached to low suction. The nurse monitors the client closely for which acid-base disorder that is most likely to occur in this situation. 1. Metabolic acidosis. 2. Metabolic alkalosis. 3. Respiratory acidosis. 4. Respiratory alkalosis. The correct answer is 2. Rationale. The loss of gastric fluid via nasogastric suction or vomiting causes a metabolic condition. This also results in an alkalotic condition due to the loss of hydrochloric acid through gastrointestinal fluid losses. Also, the options denoting a respiratory problem, respiratory acidosis and respiratory alkalosis, can be easily eliminated. On arrival at the emergency department, a client tells a nurse that she suspects that she may be pregnant but has been having a small amount of bleeding and has severe pain in the lower abdomen. The client's blood pressure is 70/50 and her pulse rate is 120 beats per minute. The nurse notifies the primary healthcare provider immediately because of the possibility of 1. Ectopic pregnancy. 2. Abruptio placentae. 3. Gestational trophoblastic disease. 4. Complete abortion. The correct answer is 1. The client's signs and symptoms indicate a probable ectopic pregnancy, which can be confirmed by ultrasound examination or by cholecystosis. The primary healthcare provider is notified immediately because hypovolemic shock may develop without external bleeding. Once the fallopian tube ruptures, blood will enter the pelvic cavity, resulting in shock. Abruptio placentae would be manifested by a board-like uterus in the third trimester. Gestational trophoblastic disease would be suspected if the client exhibited no fetal heart rate and symptoms of pregnancy-induced hypertension before 20 weeks gestation. A client with complete abortion would exhibit a normal pulse and blood pressure with scant vaginal bleeding. Which of the following anticoagulants would a nurse expect to administer when caring for a prima gravida client at 12 weeks gestation who has class 2 cardiac disease due to mitral valve stenosis? 1. Heparin. 2. Warfarin. 3. Enoxaparin. 4. Aldaparin. The correct answer is 1. Although there is no completely safe anticoagulant therapy during pregnancy, heparin is typically the drug of choice. Warfarin, a pregnancy category D drug, can cause fetal malformations. Enoxaparin is sometimes used, but clients are typically switched to heparin near labor because enoxaparin used along with spinal or epidural anesthesia presents an increased risk of bleeding in epidural or spinal space. Aldaparin also can cause fetal malformations.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.